My name is Kimberly Swan, and my integrated workplace analysis is on HCA Healthcare. HCA Healthcare encompasses 179 hospitals across 20 states and includes physician practices. At level 1 of the organizational culture, they share the same symbols and mission statement that is echoed frequently throughout the organization. I was employed by them to start a new OB-GYN residency program that will begin residence this summer. In order to establish a functional residency program, many current stakeholders needed to be engaged. One of the most important for success is engaging the current OB-GYN physicians as part of the teaching faculty. Motivation is the reason someone has for behaving in a particular way. Traditionally, physicians have been highly motivated by their profession. However, increasingly, there is a disproportionate amount of burnout in the profession. Burnout is characterized by emotional exhaustion, depersonalization, and a low sense of accomplishment. Burnout affects more than just the physician. It also is associated with increase in medical errors, lower patient satisfaction, and reduced productivity. One useful way to consider physician motivation is through Herzberg's theory of motivation. The theory provides for intrinsic and extrinsic components of motivation. The theory is more fluid, and I have found it more applicable in the medical field. Extrinsic factors such as salary, job conditions, relationships, are also called hygiene factors, and the theory holds that without these an individual will be dissatisfied, but once met they will no longer be motivating to an individual. Intrinsic factors are satisfiers and hold the power to motivate. These factors include achievement, recognition, responsibility, challenging work, and possibility for growth. We can consider some of the changes in the job makeup of a physician through this theory. Physician salaries have proportionally declined, while rates of educational costs have tripled or quadrupled over the last 30 years. And electronic health records have decreased efficiency and made physicians feel like expensive data entry clerks. These, coupled with the expectation to work nights and weekends, can lead to lower hygiene factors. Increased use of algorithms has improved patient care, but decreased the challenge of medicine, which can decrease the physician feeling of achievement. In addition, there has been significant increase in comparative performance data. This means that 50% will be below average, and by placing emphasis on these reports, physicians below average will feel devalued and demotivated. These factors decrease the motivational factors. Recognition of these factors is helpful. Some well-endowed medical schools are starting to offer free tuition. There has also been a movement toward decreasing unnecessary physician documentation that could improve hygiene factors. Identifying alternative methods to find positive deviance and bringing others up to those standards instead of using comparative performance data may also improve morale and motivation. My corporate organization has consistent downward communication. However, the multiple sources of downward communication can become overwhelming, and some employees do not engage due to the volume and lack of detail provided. Locally, group and personal meetings take place with personable administrators and allows for more fluid conversations with real-time feedback. In horizontal communication, both sides have equal power, but need to work together to accomplish mutual goals. When communicating with the OB-GYN physicians, I try to consider hygiene factors. I avoid communication overload by minimizing emails and making emails I do send brief and informational. I work to appreciate start and stop times in work groups and meetings, and I provide agendas and attentively move meeting discussions along. I also undertake individual conversations with significant intentionality and normally have a goal I need to accomplish. While I feel like I have been successful in establishing mutual respect, I am continuing to look for ways to create win-win situations in these conversations. HCA Healthcare decided to become involved on a national scale with GME in 2014. Their goal was to build their future healthcare physician workforce. This served the mission of the whole organization. Since then, HCA has established multiple new residency programs at their hospitals. Locally, I appreciate significant support from the hospital and the GME office. I started with a listening tour during multiple group and individual meetings. I learned that the physicians had previously been told they had no choice and had to participate in the residency program, and their objections and concerns had been minimized. I learned there was a significant amount of resistance and understood that one of my roles would be as a resistance manager. As a resistance manager, I would need to manage the points of resistance by responding to questions and concerns. The physicians needed to be able to opt into educating, and it could not be forced upon them. You will not get good education from someone that is told they have to educate, so it made good sense to let the physicians decide for themselves. The appropriate compensation for this time and effort involved also had to be established, and this is where the support from the administration was helpful. The opportunity to develop team building presented itself when we needed a group to interview resident applicants. This allowed me to invite formal and informal leaders from all the OB-GYN groups to participate in defining the qualities of the residency program. This allowed the physicians to set goals and priorities for interviewing and establish norms regarding the residency program, as well as take ownership of part of the residency program. Residency programs are accredited by the ACGME. The organization publishes a list of core program requirements that each program must meet to stay accredited. I anticipate using a management by objective approach to these program requirements. Ideally, I would like to present each pertinent requirement to the group of OB-GYN physicians and ask them what goals we can set to meet this requirement. The group can help set the objectives and will hopefully be responsive to feedback about their ability to comply with the objectives. For example, one of the requirements is for timely feedback for the resident. I would like to ask the physicians to establish an acceptable time frame and the amount of feedback that should be expected. Once established, the feedback method will need to be monitored, and individuals will need to adjust to be within the agreed upon objective. The continued development of the program will be an ongoing project for a number of years. The Plan, Do, Study, Act cycle will take place multiple times, and there will be many iterations of the program. The initial commitment to changing the hospital culture and its staff to adjust to having residents is unique. I have found John Cotter's 8-step process for leading change helpful. We have started to work on creating the urgency and excitement the residents will be starting this summer. We have a team that has helped develop a vision, and we are working on communicating buy-in and empowering action by removing barriers as we encounter them. I have had short-term wins that we celebrate and anticipate more. It will require continued commitment, and eventually it will stick. Thank you very much.